how to prepare for perimenopause. That is the subject we are going to talk about tonight in tonight's video. For those of you that don't know me, my name is Dr. Megan Brining, and I help a lot of women with their hormones. And perimenopause is, hi everybody, perimenopause is a really special time in a woman's life because there's lots of transitions going on. Often children are going off, they're becoming empty nesters, women are getting remarried, divorced, relationships are shifting, career roles are shifting. Maybe she's going back into the workforce now that the kids are gone. There's just so many different things that are happening in perimenopause around the same time that a woman's body tends to shift. So before I talk about the things that tend to really help women with perimenopause, I want to first establish what happens in a woman's body when perimenopause is happening. And to understand perimenopause, we first have to talk about menopause, because perimenopause is that time before menopause. So we have to know what menopause is, right? So menopause is when you as a woman have not had a period for 12 solid months or a whole year. You've had no vaginal bleeding whatsoever. And that is the period of time that we generally say a woman has achieved menopause. Perimenopause is the time frame where a woman is, quote, quote, transitioning from having a reproductive menstrual cycle to no longer having a reproductive menstrual cycle. So there are lots of things that change in that transition, and that transition can take a year, it can take up to 10 years. So one really interesting thing is that depending on your history and your genetics and what your mom and your aunts and your grandmother, what they have given you genetically, a woman can start her perimenopause transition, or she can start her symptoms of perimenopause anywhere from a year to 10 years before she actually experiences true menopause, which is no period for a year. So that's a really long time. And that generally happens for women in her mid-40s. That's the most common time frame I see, though for some women, their symptoms tend to start in their early 40s, and it's all dependent on your diet, your lifestyle, how you've been treating your body, and also genetics. So if you guys are listening to this and you're like, oh, I have no idea, what my mom went through, what my grandmother went through, go ask them if you can, because that will inform you a little bit what your transition into menopause will be like. If your mom had a particularly rough menopause transition, then it's most likely that you are going to have some of that. And if your mom had a really easy menopause transition, it's most likely that you're going to have a more easy menopause transition. So some of it is determined by genetics and just how you process different hormones, but a lot of it is lifestyle. So the things that you can do for perimenopause, I'm going to get into in maybe a couple minutes, but I first want to explain about the changes that happen in perimenopause. So we start off going into perimenopause in a time frame called pre-menopause. This is our reproductive years. So this is when a woman has a menstrual cycle, she's able to bear children, she's having, a monthly cycle every month. So, her hormones are going up and down in a nice undulating manner. She has a period, 30 days later she has another period, she has ovulation in the middle, if all things are going well. And what happens in perimenopause is that nice rhythm, that nice menstrual rhythm every month that a woman has in her reproductive years, that starts to shift in perimenopause, because perimenopause is the time where your ovaries essentially start to shut down. Your ovaries have been working really hard for you your whole life to create a menstrual cycle for you and to create hormones for you and to help you make babies. And at some point, and this is genetically determined and programmed into the body for every woman, the ovaries start to say, okay, I'm done making hormones. I'm ready for retirement. And so what happens is to have a normal menstrual rhythm, your brain has to talk to your ovaries to get your ovaries to make hormones and to get your ovaries to ovulate. And so in perimenopause, when your ovaries start to shut down, the brain is like, oh my gosh, we need these hormones. We need to ovulate. Ovaries, what are you doing? And so the brain is trying to send a lot of signal to the ovaries. And the ovaries are like, meh, I'm good. But sometimes the ovaries respond to that signal. And so because we have two ovaries, there can be a big fluctuation in what a woman experiences in her hormones. So, for example, in perimenopause, the brain will increase the signals to the ovaries to get the ovaries to work because it senses that the ovaries are starting to not work. But we have two different ovaries, and the ovaries tend to switch off for us about every other month. So typically, and this is not the case for all women, but most commonly, ovary 1 will ovulate, ovary 2 will ovulate, ovary 3 will ovulate, ovary 4, it alternates between the two ovaries because the ovaries are not twins. They're more like sisters. So it's common for them to alternate, but it's not always the case. But, one cycle, ovary 1, and then ovary 2, and then ovary 1, and then ovary 2. So when the woman is transitioning into menopause and the brain is sending those signals to the ovaries, sometimes an ovary will respond and will create an ovulatory cycle for the woman. And then sometimes the next month, the ovary will not respond and will not create any progesterone and will not create an ovulatory cycle for that woman. And so what we see, instead of a nice kind of up and down monthly of hormones like this, when you have a regular menstrual cycle, what happens is that you're kind of all over the place, because if your ovaries are not responding to the brain and they're not ovulating, when you ovulate, you make progesterone, and progesterone helps to balance out estrogen. So if you are not ovulating, you're not creating progesterone, which is the really nice grounding hormone. It helps us with our water weight. It helps us with weight. It helps us with things like our mood, anxiety, feeling really calm. And so in perimenopause, you can get things like hot flashes because you don't have that progesterone to balance out the estrogen. And so you become slightly estrogen dominant, which can make hot flashes worse. You don't have that calming effect of progesterone, so you can become more anxious. And so what's happening is that your hormones are kind of going all over the place because sometimes your ovaries respond and sometimes your ovaries don't. But what happens is, even though things are going all over the place, there's a general trend downward where even though your hormones are going up and down every month, each month they're getting progressively a little bit lower in terms of the amount of hormone that you produced. So if we, looked at someone on a lab and we tested them at the perfect time, we would probably see a nice downward trend. But because women are all over the place, we just kind of have that squiggly line effect where we see a gradual trend downward. So that is why a woman feels all over the place, often in perimenopause. She's feeling, emotional, she's crying, she's feeling anxious, she's feeling irritable because of that lack of progesterone. Sometimes her boobs are swelling. Sometimes she's noticing pain with sex or vaginal dryness because estrogen levels are starting to drop, and things just can kind of feel out of whack. All of this is considered normal, but the key is that these symptoms are not enough to disrupt your life. And if a woman in perimenopause is having severe symptoms, then that's the time that we can step in with bioidentical hormone therapy and help her not be going like this all the time, but have her kind of be slowly and nicely trending downward. So that can take the edge off of things for a lot of women. So if you guys haven't looked into hormone replacement therapy, bioidentical hormone replacement therapy, and you're in perimenopause, definitely ask your doctor about that. You'll need a naturopathic doctor or a functional medicine doctor to help you with that. Those of us that are in the functional medicine, naturopathic medicine arena, we know bioidentical hormones best. So definitely get the right practitioner. But what's happening in perimenopause is that the ovaries are gradually shutting down, but it's not like they go from 0 to 60. They sometimes will ovulate and then they will sometimes not. So a woman will have ups and downs of hormones, but a general trend downward. So I hope this is making sense. So as the ovaries give up more and more, her hormones trend down more and more. And that's when we really can see difficulty sleeping, hot flashes, pain with sex, lack of lubrication, all sorts of things. And so there's lots of things that you can do if you're not in perimenopause, or if you're in your early 40s and you're approaching perimenopause, or you're not quite sure if you're in perimenopause right now or when you're going to be approaching that time frame. There's lots of things that we can do to actually help the symptoms. So one thing that is sometimes difficult for women to determine is whether they are actually in perimenopause. I have a lot of women that come into my practice and they're starting to feel some of the symptoms that I've been talking about, and they say, I'm not sure if I'm just stressed or if I'm in perimenopause or if I'm reacting to the new medication I'm taking or if I'm reacting to some supplements or if I'm just, hot because it's hot out here. And so really, the best way to figure out if you're in perimenopause is to have some sort of cycle tracking. So for those of you that have followed me for a long time, I'm a huge fan of basal body temperature tracking because each month our hormones as women are different. And so with basal body temperature tracking, you're able to see the ovulation event, because on a temperature chart that translates into a temperature spike. And so when we have a temperature spike that's sustained on our charts, we get to confirm that we ovulated that month. So we know that an egg popped out. We know that that woman probably made progesterone. And we can kind of see from somebody's chart whether they made a lot of progesterone or whether they probably didn't make a lot. So my number one thing for figuring out if women are in perimenopause is if a woman is cycle tracking, I take a look at her charts, because we can see, oh, hey, you're starting to have anovulatory cycles because your ovaries are starting to peace out and shut down. So that's probably the first thing that I will go for. And if a woman is not like basal body temperature tracking, she can start doing that, especially if she's also having some other symptoms come up and they're all overlapping, or if she has some new conditions or new chronic conditions or new stressors and she doesn't know her family history and we're really unsure, is this just perimenopause or is this something else that we really need to investigate? Is this something that's not normal? Then I will have a woman cycle track for, 2 to 3 cycles, and that will really help us determine, hey, what's actually happening? If somebody doesn't want to cycle track for whatever reason, you can also do labs. So to figure out if you are, I'm writing this down because I didn't have it on my outline. If you're trying to figure out if you're in perimenopause, there are 2 lab markers, your FSH and your LH, that will go up the closer that you get to menopause. And generally after they are within a certain threshold, a certain height on the lab, certain level of elevation, then we will say, you are most likely in menopause. Or I often tell women, your FSH and LH is at a level that is high enough that I would be surprised if you had any more bleeding or you had any more periods. So if your FSH and LH is up somewhere around 30, 40, depending on what literature you're looking at, 40 is more of a solid benchmark, then we can for sure say okay, yeah, you are definitely either kind of trending towards menopause or you're really about to get there. So I use labs a lot. Labs can also tell us, depending on what day of the cycle that we test them, they can also tell us, is your estrogen trending downward? Is your progesterone trending downward? How is your testosterone level? Because testosterone, the ovaries make testosterone for us. So if the ovaries are piecing out and they're starting to shut down and they're not going to make our female hormones for us, and we're we're going to stop having our period, then sometimes our testosterone gets affected. So sometimes that's why libido goes down in perimenopause, and that's why some women experience like depression or lack of motivation or some anxiety, and it can be because testosterone is shifting. So I will often start with a blood panel with women, especially if they're not cycle tracking, because that will tell me pretty quickly whether or not they're actually in that time frame or not. And yeah, Daisy, I will share a link to the tracker. So when I'm talking about cycle tracking, I typically have women use apps on their phone, and there's lots of different apps. When you're basal body temperature tracking, the point of the tracking is to put those temperatures that you get every morning into either a spreadsheet that you manually use, or you put it into an app that charts the temperature, so you get to see the lines all between the data points. And the key for looking at for picking an app is that you want an app that is not predictive. You just want an app where you put in the data and then you interpret what's going on in the chart. So you don't want to pick an app like Natural Cycles, or even the Daisy thermometer is not a good choice because that is largely predictive as well. So find an app where you just put in the data and then you can see the trend. But I'll put that in the comments in the video when I post it, and I'll also DM you, Daisy. Great question. My favorites are Read Your Body. If you are a really in-depth long-term charter, that is the best for all types of basal body temperature tracking and fertility awareness. If you are just quick and dirty, new to this stuff, want to try some things out, then Kindara is a great app because it has a free version that's really, really easy to use. So for anybody who's cycle tracking, whether you're 13 or 50 or 35, it's going to be really approachable for you. So my top tips to figure out if you're in perimenopause, because that's the biggest question I get, you guys, is, is this perimenopause or is this something else? So I talked about cycle tracking. I talked about labs. One thing, I want to talk about a couple things that can help, because determining that you're in perimenopause is one piece of the puzzle, but we want to be able to help support your body to have the calmest, nicest transition into menopause as possible. The biggest way to have a really smooth menopause transition is to decrease stress. And I know everybody talks about decreasing stress, but ladies, this is literally the biggest thing that you can do. So if you are working 3 million jobs, if you have too many home responsibilities, if your relationship is not serving you, if your finances aren't in order, whatever is stressing you out, get on top of it and make that thing your number one priority. This can be probably the most difficult thing for people, especially if they're in certain relationships or certain stages of life, or different things are happening at work. But that can be the biggest thing that can help women. The reason why is because when you are entering perimenopause, your ovaries are shutting down. When your ovaries shut down, so does that amount of production of that hormone. When we're talking about our estrogen, progesterone, and testosterone, our adrenal glands make a certain percentage of that, and our ovaries make another percentage of that. So the amount of estrogen, progesterone that we make before menopause, ovary-wise, is about 80%. The other 20% comes from your adrenal glands. But as you're going through perimenopause and you get into menopause, that ratio totally shifts. So 80% of your hormones are being made by your adrenal glands, and only 20% or less is made by your ovaries that have mostly gone on vacation and they have retired. So there's a huge shift from ovarian production to adrenal gland production. And as you guys know, the adrenal glands manage stress for you. They're big creators of things like cortisol. They help manage your blood sugar. They help you run away from the bear. They create epinephrine and norepinephrine. So if you have stress, or if you have a diet that's not supporting you and you have blood sugar ups and downs, then your adrenal glands are going to put a lot of energy into creating those hormones. They're not going to have as much oomph to make your actual female sex hormones that you need. So when you go through perimenopause to menopause, you are not going to feel well, and you're going to have more symptoms because your adrenal glands can't make the adequate amount of hormones that you really need to feel like a pretty stable and grounded woman. So anything that we can do, whether it is working on sleep, which would be in my next point, sleep and stress, getting those dialed in, anything that we can do to help decrease the load off of the adrenal glands is literally going to be the hugest help for you women that are in that perimenopause timeframe, or if you're like right before that and you're kind of worried what's going to happen. Get your stress and your sleep dialed in. Because your adrenal glands are going to be picking up the slack as your ovaries shut down. And if they're not healthy enough, they can't make the hormones that you need to feel balanced and to feel well. And we really don't want you to feel like a crazy, anxious, depressed, frazzled mess. And that's often what a lot of women will feel like. So get your sleep dialed in. I recommend women to get 8 to 9 hours a night. We tend to minimize sleep, especially as women, because we have so many responsibilities, and we have responsibilities in the home, work, all avenues. But we really have to prioritize that, because that's how our body is going to rest and regenerate and get ready to deal with the stressors of the next day. So you guys can see how this is all playing a role. So sleep and minimizing stress. I'm so glad I wrote an outline, because I'm really on keeping on point tonight. Another thing that can be really helpful is changing out your workout routine for something that's totally different. So for women that are in the cardio realm with their workouts, it's best for you to switch to a more weight-based training, whatever that is, whether it's high-intensity interval training, whether it's just straight up lifting weights, whether it's body pump classes. You have to switch away from just cardio to more muscle building. And the reason why is because as your estrogen, your progesterone decline, you don't have the same beneficial effect on muscles that estrogen does. Estrogen supports muscles. So it's often harder as we age to keep on adequate muscle mass. But also with the changes in cortisol and estrogen and testosterone and progesterone, so does our metabolism. And a lot of women within the perimenopausal time frame going into menopause, they will typically report anywhere from 5 to 20 pounds of weight gain. I would say 10 to 15 is the most common that I see. And they'll notice that, they get more like central weight gain. That's the biggest part, sometimes around their hips, but around the tummy seems to be the trouble spot. But that's because you don't react to cortisol as well without those hormone levels around like you were when you were younger. So as estrogen and progesterone and testosterone go down slightly, your ability to deal with cortisol is totally shifted, because all of those hormones affect how your body uses cortisol. So decreasing cardio and increasing weights has a huge effect on your metabolism, which in turn makes you feel so much better and grounded as a woman, but it also helps to stave off any of the, really natural weight gain that can happen during this time. And, I work with a lot of women in this boat, and that tends to be probably the most concerning complaint that they have. Sometimes it's the lack of sleep and the hot flashes, but the weight gain tends to be the most concerning because they've been, in their cycling years, they've been a really consistent weight. And then suddenly when their hormones start to shift, then that changes their weight. And that's super, super common. And we can mitigate that with different techniques, managing your stress, focusing on sleep, decreasing cardio, increasing weights. Those are all huge things to help mitigate that weight gain. For those of you that just joined, welcome. We're talking about my tips for helping the symptoms of perimenopause. We talked about what menopause is and what the perimenopausal time frame is. So if you missed that, feel free to give this a rewatch. But I want to talk about some herbs now that can be really helpful for this time frame. Because if you guys take nothing away from this video, it's that stress is one of the biggest factors in how you are going to weather the perimenopause to menopause transition. So if you don't have that on track, or you're not doing lots of things to support the stress levels that maybe you can't get away from, if you're not supporting your stress, then everything is just going to be a lot worse. So I like to use herbs with women just because they're gentle, they're effective. You can use lots of different kinds of herbs. We have research on certain herbs that stimulate different pathways in the body, so we can really know that we're going to get certain effects by using different combo of herbs, which is awesome. So I will often use either adaptogens or nervine herbs with these women. And the reason why is because the nervous system is generally overloaded in the 40s decade, because like I was talking about before, the 40s decade is busy for women. It's when family dynamics are shifting. It's when career dynamics can be shifting. Just lots of shifts are happening during this time. So I give women nervines to help deal with the effects of nerves and the nervous system. And these are things that are calming. They also help to modulate mood, which is really helpful, because as your estrogen goes down and your progesterone goes down, you can become more depressed and a little bit more anxious and irritable. And so I'll often do things like hypericum and St. John's wort, or I should say hypericum, which is St. John's wort, not St. John's wort. But that is an herb that's really, really helpful for mood for women, especially women in the more depressed, frazzled state. I will often do adaptogenic herbs like ashwagandha, panax ginseng, eleuthero, which is one of my all-time favorite herbs for almost any stage of a woman's life besides pregnancy. I will do schizandra because that is an herb that goes well in so many formulas, but it's really good at bringing joy back, and it's a really, really safe, tasty herb. It has another name called 5-flavor berry, and if you've ever taken a dried schizandra berry and put it in your mouth, it's like a flavor explosion that you've never tasted before. It's like sweet but astringent but bitter but really yummy all at the same time, but also oh my gosh, I can't believe I put that in my mouth. It's like a flavor explosion, and it's so good in a tea, and it's really good as a tincture. So I love schizandra for any of that mood piece. Sometimes the 40s decade comes with a lot of grief and a lot of transition that a woman might not be capable or willing or ready to acknowledge. And so herbs that help with that mental emotional part of just coping with a variety of things in life can be really, really helpful. So I like things like hypericum, chamomile, schizandra, hibiscus. There's so many that I could list here. But I will often use herbs in general to help with the mood piece, sometimes even help with hot flashes, depending on the woman. So I will loop that in specifically to help with the nervous system, to help support the adrenal glands. The ovaries are not necessarily a system that we're going to support, because the ovaries are on their natural decline when we are in perimenopause. So ovarian support is more useful for a woman when she is cycling and she's not in this perimenopause time frame. So we're coming to the end of my points. So for those of you that have been following along with me, if you have questions, please shout them out. But tonight we talked about perimenopause and what exactly happens with hormones in that time, and what does menopause mean. We talked about how to figure out if you're in perimenopause. So to figure out if you're in perimenopause, you have to cycle track. And if a woman is not cycle tracking already or doesn't want to, then sometimes we will run a blood test to really determine where her FSH, LH are, which are two different hormones that talk between the brain and the ovaries. That's the brain talking to the ovaries to get the ovaries to work. And if those are elevated, then we know that a woman is is in perimenopause and she's approaching menopause, and she's likely to stop having any sort of bleeds, any sort of menstruation happening. We talked about how to decrease stress and how important the stress piece is. We talked about sleep. We talked about how we need to change our workouts away from more cardio-based workouts to weight-based workouts. We talked about herbs. So thank you everybody for following along, and we will be back next week for another episode of Instagram Lives at 5. For those of you that are here, if you have any questions, put them in the chat. Sometimes there's a lag here, so thank you all for tuning in. This is a lot of fun. And if some of you guys are just tuning in, I'm Dr. Megan Brining, if you don't know me, and I help women with their hormones, whether it's perimenopause, menopause, period problems, postpartum, adolescence, and periods. It's all my jam. It's so much fun. If you guys are looking for a naturopathic doctor, when you are looking, plus come see me, but when you're looking, make sure when you're trying to get help with your hormones that whoever you're thinking about going to go see really loves hormones, because they're so complicated, but I love that they're complicated. I think it's fascinating. So make sure that they really love hormones, because then you'll know that you're in the right place and you're going to get some good care and you're going to get some really good expert advice. So thank you everybody for joining tonight. We did a little bit of a shorter video, which is great. And I will see you guys next week. It'll be on YouTube. Bye.